I'd like to take a look at the oft-forgotten blood supply of the midline. For many of us, think about the blood supply when we have medial lateral anatomy, like an axial or a coronal. But we see so many of these, and vascular disease on this particular cut can be a little confusing. By the way, pay no attention to this little finger-like projection, which is just volume averaging of a gyrus in the inferior frontal region. Let's start out with the anterior cerebral artery in red. I think you're going to be surprised at how far back it goes. We've already told you the frontal lobe goes up and back pretty far, but the anterior cerebral artery will encompass portions of the precuneus. So let's take that pretty far back, and then I need to take it down a little further, and I could color all this in right here, and this would be anterior cerebral artery distribution. Now, there's some variability in how the ACA and PCA intersect each other. I'm going to use kind of deep purple in honor of Jimi Hendrix to finish out the posterior cerebral artery. And the posterior cerebral artery will come down and encompass everything right up to the collicular plate right there, and then there are sometimes collicular perforators that may come from the back, and it stops just shy of the cerebellum. Then, to be anatomically consistent, we're working away from top to bottom. Let's go with a green color for the upper portion of the cerebellum, which is probably about half the cerebellum. And that's going to be the SCA, or superior cerebellar artery. I should mark the PCA with PCA, just for your perusal and interest. The next stop is going to be pica, which is going to encompass the inferior cerebellar vermis and the cerebellar tonsil. And some of you are familiar with pica syndrome or Wallenberg syndrome, which is a pretty important one, especially for you medical students. Then we work our way into the region of the corpus callosum, and here we've got medial lenticular striates and callosal perforators, and these pretty much have their own locus. I'll use a light blue for this, and I'll color in the callosum. Although the back of the callosum is not supplied by these perforators, the back of the callosum, I should note, is supplied by the posterior cerebral artery. I'll give it a little deeper purple. So that's still posterior cerebral artery blood supply right there. Now let's work our way into the brain stem. I think I'll try something a little bit orange for the midbrain, and projecting from the midbrain up into the thalamus, pretty tall, almost columnar-like area, encompasses some of the mammillary body as well. I'll color it in, and that is the posterior choroidal and posterior thalamo-perforating arteries from the posterior cerebral artery circulation. So perhaps I'll label it as officially PCA, but there are perforates. They are not the main vessels that supply that area. Then we'll come down to kind of a deeper blue, and we're in the pons now. And these are perforating branches of the basilar artery, pretty simple. I'm not going to, actually I will draw them in. Basilar artery perforators, BAP. And now down to the region of the medulla of the brain stem. These are perforating branches of the vertebral artery. I'm going to use something a little aesthetically less pleasing, brown, and there you have it. The midline blood supply of the brain, oft overlooked. Pomerantz out.